What's up, developers? Welcome to Talking AI, where we break down the AI news that actually affects your code, your wallet, and your weekend plans. Here's something I didn't have on my 2025 bingo card. A medical AI company going from a $2.75 billion valuation to $5.3 billion in just 4 months. That's not a typo. Abridge, the AI medical Scribe company, just closed a $300 million Series E led by Andreessen Horowitz, and honestly, I'm starting to think healthcare AI is the new crypto in terms of completely absurd valuations. So let's break this down, because the numbers here are aggressive. Abridge hit $117 million in contracted annual recurring revenue in Q1. That means investors just valued this company at roughly 50 times revenue. For context, that's like valuing a SaaS startup making $100K annually at $5 million. It's the equivalent of paying Tesla prices for a company that makes one really nice bicycle. But here's the kicker. This isn't some vaporware startup. Abridge actually has a product that works, with over 150 health systems using their tech, including Johns Hopkins, Mayo Clinic, and UChicago Medicine. These aren't exactly known for adopting random AI tools without serious vetting. For developers who haven't dealt with healthcare tech, here's what Abridge does. It listens to doctor-patient conversations and automatically generates clinical notes in real time. Think of it as an AI-powered stenographer that actually understands medical terminology and can structure notes properly for billing and compliance. The key differentiator? They're deeply integrated with Epic systems, basically the Windows of electronic health records. And when I say deeply integrated, I mean they're part of Epic's Partners and Pals program, which is apparently a real thing and not just what I call my development team. Plot twist. Being Epic's first PAL in this program is actually a massive competitive moat. Epic runs about 60% of all electronic health records in the US, and getting that level of integration is like being the default search engine in Chrome. Once you're in the workflow, you're really in. From a technical perspective, Abridge isn't just doing speech-to-text and calling it a day. They've trained their models on over 1.5 million medical encounters, and they support 28+ languages across 50+ medical specialties. Their linked evidence feature maps AI-generated summaries back to the source conversation, which is basically version control for medical notes. For the open source crowd, good luck competing with this level of healthcare data and Epic integration. The regulatory moat around healthcare AI makes breaking into this space about as easy as starting your own payment processor. Now, before you panic about missing the healthcare AI gold rush, let's talk about what this actually means. The medical scribe market is having a moment because doctors are drowning in paperwork. US physicians spend an average of 2 hours per day on documentation outside of work hours, what they call pajama time, which honestly sounds way more fun than it actually is. But don't be shocked if you find your physician at a park near you partaking in some downtime with their fur baby. That's just wholesome. They claim their users reduced documentation effort by 86% and after-hours work by 60%. If that's accurate, and if you're a hospital administrator watching your doctors burn out faster than JavaScript frameworks go out of style, $5.3 billion starts to look reasonable, maybe? But wait, it gets worse for everyone else in the space. Abridge isn't just competing with other AI startups, they're competing with Epic itself, which is building its own AI documentation tools. It's like being a Chrome extension company, while Google is building the same feature directly into the browser. The other major players include Ambience Healthcare, which reportedly just raised at a $1 billion valuation, and companies like Suki and Augmetics, but none of them have Abridge's level of Epic integration, which in healthcare is like having admin access while everyone else is working with guest accounts. Translation for developers. If you're thinking about building in the healthcare AI space, understand that this isn't just about having better algorithms. It's about regulatory compliance, data security, integration complexity, and navigating a procurement process that makes enterprise sales look like buying apps on the App Store. The real impact, Abridge's success, validates that AI can actually solve real problems in heavily regulated industries, but it also shows that the barrier to entry is getting higher, not lower. You need massive funding, years of data collection, and enterprise-level partnerships just to get in the game. Here's what this actually means for the industry. Abridge is expanding beyond just note-taking into medical coding and billing, basically turning patient conversations into billable revenue. That's smart business because instead of just saving costs, they're helping hospitals make more money. It's the difference between selling a cost-cutting tool and selling a revenue generator. My take? This valuation makes sense if and only if Abridge can expand into other parts of the healthcare workflow. At 50x revenue, they need to become the platform for AI-powered healthcare operations, not just a really good note-taking app. For developers, this means your API costs probably aren't going down anytime soon, and if you're working on healthcare projects, expect integration complexity that makes OAuth look simple, but it also means there's real money being made solving actual problems with AI, not just generating better chatbot responses. That's the TLDR on Abridge's $5.3 billion moment. A medical AI company just convinced some very smart investors that automatically generating doctor's notes is worth more than most unicorns. Whether that's brilliant or bonkers probably depends on how much time you've spent trying to read your doctor's handwriting. If this saved you from reading 47 healthcare AI think pieces, hit subscribe. And if you're building something in the healthcare space, drop a comment. Would love to hear what you're working on and how you're dealing with the compliance nightmare.